Welcome everybody to the Art of Science TV, where we converge, connect and converse on all things science. We started this program a couple of years ago now, and it was to bring you regular COVID updates. We've tried to depart away from that and to get into some more science, but COVID is showing us that it's not going away soon. So today's conversation is going to be led off again by Dr. Tim Boyle, who is strengthening society by putting science to work. He's also the Director of Innovation and Commercialisation at ANSTO. Welcome, Tim.
Thanks, Christina. It's by myself again.
You are indeed. So very soon, I hope to have the whole contingent back, but we'll just see how that goes. Tim, you know, we keep trying to move away from a constant conversation around COVID. COVID is not going away. It's not even lessening its impact, which is potentially what we predicted it might have done a little while ago. It's currently riding its third Omicron wave caused by BA4 and BA5. With this wave, hospitalisations have been rising. Death rates are actually higher in Australia than what they have been previously. What does this all mean for people?
Yeah, on the surface, it looks like the BA4 and BA5 subvariants are causing a more significant disease. And that's what you interpret from a lot of the data and the media that's coming out at the moment. But this is not necessarily maybe the case. I think it's worth unpacking this a bit more just to see what really is going on. So when mutations occur within a virus, they must provide an advantage to that new variant. So that new variant can outcompete the previous variants and be able to spread more rapidly. So you have a variant that, it's endemic and it's pushed through the society, through the community. For a new variant to outcompete that, it has to have significant advantage. And that usually comes down to three factors. Now, one, that they can replicate faster than the previous variant. Two, that they are better able to latch onto human cells, so that binding specific domain has a tighter lock and key type fit. And the third is that they're better to escape our immune systems and evade whatever immunity we have, whether that from a previous infection or from vaccination. And a lot of the concern at present is that our health system will soon be overwhelmed. Then there's potential for loss of life from the disease. And at this point, the number of COVID cases is rising, but still well short of the peak seen earlier this year with the first Omicron wave. Yet hospitalizations and deaths, they're nearing previous peaks. So, what's going on? Firstly, we're seeing a gentler curve with these current variants. The first wave of Omicron late last year, early this year, caused by a BA1 subvariant, that without an epidemic curve that rose very sharply like a cliff face to about 100,000 cases a day across the nation, across Australia. So we've got a global audience. So 100 cases a day in Australia at its peak in early January. And the second wave, caused by Omicron BA2, had a much gentler curve and peaked at the end of March with more than 60,000 cases per day. And the BA4 and BA5 curve is looking gentler still, with current daily case numbers at around 35 to 40,000 per day. And I think what's interesting here is that the cases in New South Wales, which is about a quarter of these cases, where New South Wales also previously had the most cases, the majority of cases in Australia being in New South Wales, the new case levels have been quite stable. For the last few weeks, they've hovered between 8 and 13,000 within that sort of bracket, going up and down. But the case numbers across the country have been growing, which indicates that there's probably some inherent immunity that's greater within New South Wales. And we're just seeing it sort of trickling along, where we're seeing sharper curves across the rest of Australia. And it's unclear why we're seeing these changes in successive Omicron waves. But as I suggested, what we're seeing from New South Wales, it could be due to differing levels of immunity in the population over time, and along with the genetic makeup of the subvariants, which means that the inherent immunity within society and the innate immunity is built up to a level where there is some herd protection, and it's softening that curve. So it's not like something everyone gets and it just rips through. It sort of trickles through, and a few people who may have evaded the virus in the past get infected, but it's not the alarming sort of rapid infection rates which we were seeing at the start of the year. And a lot of the alarm that we're seeing in the media at the moment, because since the beginning of June, hospitalizations have been increasing at a rate faster than the case numbers. And what I really think here is that hospitalizations are, they're difficult to interpret, as there's no agreed definition of what hospitalization is. So, for example, do you include hospital in the home or patients diagnosed after they've been admitted to hospital for something else? That is in hospital with COVID or in hospital because of COVID. What's the differentiator? And there's no distinction in the way that these numbers are being calculated. And admissions to hospital intensive care units, and that being a trip to the ICU, is much easier to interpret, because if someone's admitted to the ICU, they're critically ill. And since the beginning of the year, there's been a declining proportion of hospitalised patients being admitted to the ICU. And that's a decrease from 9% of hospitalised patients with COVID down to 3% of hospitalised patients with COVID. So we're seeing a significant reduction in those becoming critically ill from COVID across this year, as we've seen progressive waves, the third wave of the Omicron variants. And I think the other really important consideration is the integrity of new case data. In reality, the number of daily cases can really be considered an estimate, with the true number of cases likely to be several times greater, because we know that asymptomatic people don't usually test themselves without good reason to. Those with symptoms might think it's just a common cold and not test themselves, especially in winter. And those who test themselves with a rat test at home may have a reasonable chance of a false negative result, especially in the first 48 hours of the virus. I think what's most likely what's occurring is people who test positive on a rat test know that they're not in a high risk category and may not report the fact that they're a COVID case to the authorities. Therefore, they knowingly got COVID, they isolate, treat themselves at home, but feel no reason to disclose to the government that they're actually infected with COVID. So because of this, the numbers of hospitalizations, the increasing number of hospitalizations we're seeing might be due to more undiagnosed cases in the community. Therefore, as a percentage of those hospitalized versus number of cases, that percentage gets skewed. So it looks like hospitalizations are going up as a percentage of new COVID cases. But in reality, we're seeing 40,000 cases per day across the country. That could be 10 times higher. That could be 400,000 cases a day, and 90% of them aren't being disclosed. And another more morbid indicator is the number of deaths, as COVID deaths are now going up at a rate faster than cases. So again, this could simply be because there are more people in hospital with COVID plus other illnesses because of winter, and that leads to a higher death rate. And this could be why we're seeing more deaths now. I guess to summarize all of what I just manifested together, it's not a clear-cut case of the current variants causing a more significant disease. Even though data shows hospitalizations and deaths increasing at a rate faster than case numbers, this could be because the numbers being counted on having COVID in hospital versus being in hospital because of COVID, the winter effect, more sick in winter, underdiagnosis, underreporting, or a combination of all these factors put together. And I think that the advice that we always give still holds true. The best thing that we can do at the moment is protect ourselves and others from infection. And this is not difficult. It's the same message we keep repeating. We can make sure we're up to date with our booster shots and our immunizations, have adequate social distancing when we need to, and wear a face mask when we're out and about in high-risk environments. If we do these things, we can slow the risk of and transference of the disease and the virus, and protect our loved ones and protect our own health as well as other public.
That was very nicely punctuated too, by the way, Tim, with that with your cough there. Yeah. So can I ask you, the masks are maybe not going to be mandated again, depending on what different states want to do with that. Victoria has suggested heavily that, or with some emphasis, that school children go back to wearing masks. What do you think? What are your thoughts? And again, we're moving away from research because we don't know. This has not been researched yet. But what are your thoughts around, the teachers in different schools, different classrooms, parents, etc., asking school children to don masks again?
Yeah, so I think this is a difficult one because children, it was never mandatory for children to wear masks in school, not in New South Wales anyway. So I think it's a difficult one. We're not seeing the case numbers or the official case numbers that we were earlier in the year. So I still think that it's, our personal responsibility is to look after our health. We can't ignore that the virus isn't there. However, at the same time, we can't go back into a cupboard and pretend that the world's not there and into lockdowns and isolations. We have to move to the other side of this and start learning to live with the virus as well. So I take a measured response. I don't think we should be telling kids what to do, but teachers certainly, it's occupational health risk for them. They should be wearing masks if they feel that they're in danger of contracting the virus.
Do you think the virus has behaved as some scientists thought it might in the beginning, where it would peter out and become less intrusive? Do you think it's become intrusive because we're so aware of it? Like, what are your thoughts around that? Is the virus itself more intrusive? I mean, I walk past more and more stores, restaurants, cafes every day that say we're closed, where we can't get enough staff. Is the virus more intrusive, or are we more cautious in going to work with some symptoms of a cold, etc.?
Yeah, I think we're very much as a society much more conscious that when we're sick, not to give that to others. Pre-pandemic, many people who had a cold or a flu would head to work and soldier on and take Lemsip and cold and flu tablets and pretend they weren't sick and carry on. And I think that it's now socially acceptable. If you're sick, don't go anywhere. Stay at home. Work from home. There's no stigma around working from home anymore. And many big corporations just this week have announced that please staff stay at home, work from home where you can. So I think that perception's changing. Of course, where that impacts is hospitality and retail, where you can't work to those sorts of that type of employment isn't suitable for at home. And when that happens, obviously it puts a pressure on those businesses, and that's why we're seeing impacts in the supply chain. So we're seeing our restaurants and cafes temporarily closing. We're seeing shortages in supermarkets of produce. I was in my shopping on Tuesday night and there was no meat at all. There was no fresh veggies. It was like the supermarket had been decimated. And that's just because delivery drivers, farmers picking, fruit pickers, so all through the supply chain has been disrupted with staff shortages, and then result is that we don't get food to the point of sale or produce. And I think but we're becoming more accepting in society of what this looks like, although it's really frustrating when you go to buy something, it's not there.
I totally agree with you. I think we are becoming much more accepting in most cases, and much more, I want to use the word compliant, but I don't mean it to sound like we're robots and we're falling into line. But I think we're, understanding is a really good word, that things may take longer, that we need to be more flexible in what we're buying, the lettuce, etc., due to the floods even. So it's not only the pandemic and sick drivers, for example, but it's also produce hasn't been available. And I heard an interesting take on some of the fruit and veg that said when it's at an exorbitantly high price, it's because you are not meant to buy it, because it is the leftover produce. And if you are desperate enough to buy it, then you're desperate enough to pay, $12 for a lettuce, for example. So I totally fall into agreement with that whole supply chain, let's be more tolerant issue. Do you think we are becoming more tolerant also of the fact that a restaurant may not be open, and we're not going to say, well, just because my favorite cafe is not open today, I won't go back tomorrow, and we're becoming more and more tolerant of slow service affected service in the hospitality industry as well?
I think there's a double-edged effect here where, in the past, pre-pandemic, people would have been really put out of sorts when restaurants and things were closed or cafes were closed. They couldn't get things they normally could. But now I think, especially cafes and restaurants, because of the massive rapid rise in inflation and the cost of living, that sometimes that's discretionary spending, and the budget for that just doesn't exist anymore. So I think that the supply and demand at the moment is probably matched, in that people aren't going out to eat at restaurants as much. Therefore going and takeaway coffee a few days a week to make ends meet, which is sort of countering the the closures or the reduced capacity in some of these hospitality businesses.
Yeah, it's really interesting to notice. So the virus reacting as we thought it might, as it might peter out, has been quite a common conversation. And we know that the flu, for example, there's variants of the flu every year. Is the virus actually, is the COVID virus mutating faster than the flu, or is it pretty much on par? We hear, it's gone to B4, B5 now. I wouldn't even know what variant the flu was up to because it's not in the media. But does the flu virus have as many variants as the COVID virus?
Yeah, so they're two very distinctly different types of viruses. So coronaviruses, like COVID-19, they're very simple viruses in comparison to influenza. So influenza mutates all the time. So the surface protein structures of influenza are continuously changing. And that's why it's very, very difficult to treat with antiviral agents and prophylactic type medicine. There is, Tamiflu and Relenza are the standard of care as a sort of a measure antiviral agent for influenza, because it finds the neuraminidase binding site on the viral protein. And that's a constant protein that doesn't change on the surface of the virus. But aside from that, influenza is very, very difficult to treat, but it's mutating all the time. Whereas on the other hand, coronavirus is much more simpler. So mutations take a lot, the chance of probability of mutation is it's probably similar, but you're seeing a lot lower. Therefore, and the probability of a new variant of concern coming out that can outcompete existing variants is a lot lower. So I think that it's not fair to say that there is one have variants faster than the other, because they're very, very different viruses. But touching upon something you said, is it sort of traveling the way we expected it to? And this is where things are divided, because you'd expect that as viruses mutate, they're moving away from the original virus in terms of structure, and therefore they're picking up competition in terms, competitive advantage against the other variants in terms of their binding capability and transmissibility, because ultimately the viruses need the host to survive, and the faster you can affect the host, the more prosperous or successful that virus will be. However, but as you move away from the original structure, by changing key amino acids that it codes in the virus, what you potentially are doing, you expect, is that you're moving away from some of the more pathogenic proteins that are expressed by the virus, and they're the ones that make you sick. So there's two schools of thought, and you see competing experts, depending on which way the media goes. They'll bring up the expert that will say that over time you expect it to peter out to where it's not a significant disease anymore. And those ones, when those sorts of experts tend to get pushed to the side when there's a new variant. And then you have they're bringing the more alarmist type experts who say there should be no change, and there's a probability that things will get worse. And of course, that's always a probability that you could mutate into a virus that causes more severe disease. But you're doing that. It's a balance, and there's no right or wrong. I think from modern day virology and immunology, where we've got sequencing data available and all a great number of characterization technologies, this is the first real pandemic that's been widespread where we can do the analysis. So I don't think there is, this is my belief from what I'm seeing, I don't think there is really a standard scientific position on this. There's just lots of theorem that won't be enough data to adequately prove until after the pandemic or after the next pandemic.
Yeah, I think it's very interesting that we need to keep reminding people that we're part of a living experiment, and there are no immediate answers. We're following the research, following the science as it happens, but it all takes time. For it to be reliable, it takes time. Talking about research and science, Tim, and if we move away from COVID, what other interesting aspects around the art of science have come across your desk potentially this week? Have you got anything else to share with us around science and what's happening in the field?
Not really. I've been my head completely into the policy landscape in the last few weeks because, as you would have seen, those in Australia would be aware that just prior to the last election, there was a whole lot of new policy reforms around research commercialisation, the University Research Commercialisation Scheme. There's a number of components to that scheme. There's the Australian Economic Accelerator, there's the University Trailblazer program, there's industry PhD programs, there's investment into main sequence ventures, which is the CSIRO venture capital fund. So just prior to election, this was about to go through Parliament, and it didn't make it through before caretaker period happened. But now we're past caretaker period. The new government is forming, or it was formed, and the question is, when will what will happen to that piece of legislation? Will it be significantly changed? It did have bipartisan support prior to the election. However, is that still the case? Will things be renamed? The departments are starting to look at recruitment actions to bring people into roles to support some of these initiatives. So it's an interesting time. I can't quite work out what's happening. So I've got my ear to the ground trying to work out what the implementation of these is looking like, and how we can best position technologies against potential research expertise and industry capability. So I've been well in the policy space over the last couple of weeks, chasing up through my government affairs contacts on what's really happening.
I think that in itself is an interesting conversation that you just shared with us as well, in the whole land of science, and because there are a lot of startups in science, and often we don't affiliate startup land with science land, and yet at Nanjing Innovation there's a great community of startups working in that space. Is there anyone that you'd like to highlight in the last few minutes that we have now that you haven't actually talked about before, or any exciting events coming up at Nanjing Innovation?
Yeah, so there's lots of events and things coming up, including we have a number of events for SMEs to learn about deep technology innovation and how your business can become more entrepreneurial. We're going to have some programs that we're running, as well as announcing our first, what they call them, entrepreneurs in residence, or founders in residence, I think is probably a better term, because we're not looking for experts to help people, but experts to jump in and steer the ship with people. So that's all coming up over the course of the next few months. But there's also a really interesting ecosystem development that I'm working on around the southern Sydney region, because if you look at a lot of the infrastructure and forward city planning, especially around innovation, the investment goes from east to west across the city, from the CBD, Westmead, and then the Aerotropolis. But the north of Sydney and the south of Sydney get completely forgotten. And then you jump to Newcastle and Wollongong, which are also now got forward city planning. So I'm developing, I have been working on for some time, a Southern Sydney Innovation Network, which is an alliance of innovation-intensive businesses and active partners across the Sutherland Shire, George River Council area, Bayside, Bankstown, Liverpool, and Campbelltown LGA areas. And we're inclusive. We'll count Wollongong as well if they'd like. But we're really showcasing what comes from Southern Sydney and the opportunities that are here, because there's more critical mass happening in the area than there is across some of these more priority precincts. Australia has 8 unicorns, which are startups with a valuation of more than $1 billion, and 2 of them came from the Sutherland Shire, where I'm based now. So I think that's something we celebrated, and we need to make sure that we don't ignore the parts that are creating the value, and we actually add more fuel to the engine to keep it going, but go faster.
So, Tim, for those listeners that don't know, which are the 2 unicorns that have come out of the Shire?
Yeah, so the first one would be Campaign Monitor, which is with MailChimp, is one of the global standards for email marketing and campaigns. And the second is Deputy.com, which is a HR support platform. It's a SaaS product. And Steve Shelley is the founder is a long-term Sutherland Shire resident. Neither of these companies are based in the Shire anymore, but their roots are in the Shire.
That's wonderful. And it's lovely to know that all these things are happening in Australia. And I don't think that we highlight and say or blow our own trumpet enough with the innovation that's happening in this country. On that, do you have any closing words of wisdom for our listeners today?
Yeah, I think it really is about taking a common sense approach. There's lots of silly things happening in the world at the moment, and it's easier to poke the low-hanging fruit as being part of the problem, but those problems and low-hanging fruit are the opportunities, and we should be flipping our mindset to being positive about what's happening and how we can create opportunities from them, because the world's changing. We can't stop that. The world's never not been changing. Until we get our mindset set that the change is the opportunity, as a society, we won't progress. We'll just continue to go sideways.
And for me, I've got to say that very much following on from what you're saying, I have been, I'm an innovation tragic. Those of you that actually are familiar with what I do know that I'm an innovation tragic. And I am constantly baffled by the question, how much money will I save if I innovate? And my constant response is, how much money, how many employees, and how many clients will you lose if you don't? So there are different ways of measuring ROI, and there are no guarantees, as we know, in anything. So innovation is everybody's business. Tim, thank you for joining us again today. Look forward to speaking with you again next week, and also hoping that we can welcome back our other panelists next week as well. So thanks for joining us.
Thanks, Christina, and thanks everyone for listening and tuning in.
And if you've enjoyed this episode of The Art of Science, please share it with colleagues, family, friends, and send us any questions or any topics that you would like us to delve into as well. Until next week, stay safe, wash your hands. If you are so inclined, wear a mask, but let's really look after each other. See you next week.